Well, my work in academic family medicine began when I was a family medicine resident, and in my final year of training we had a special skills year where you could learn academic skills, and I joined the Department of Family Medicine at Monash University in Melbourne in Australia and learned about primary care research, learned about family medicine education, as well as continuing to be a practicing family doctor. I remained at Monash University for a number of years. I did my doctorate there, which had a focus on using new technologies to meet challenges in medical education. And then in 1995, I was appointed to the chair of family medicine at the University of Sydney. And I worked there for 13 years, and then in 2009 I was appointed as the Dean of the Faculty of Medicine, Nursing and Health Sciences at Flinders University in Australia. In Adelaide. And throughout that time I've been involved in family medicine research. The focus of my research has been around particularly global primary care, but also the use of new technologies in family medicine, digital health and e-health. I've had a particular interest in quality and safety in family medicine, and also a specific clinical interest in the primary care management of people with HIV, viral hepatitis, sexually transmitted diseases, and also mental health. I've also had a very strong interest in Aboriginal health research as well, and that continues today. Well, a lot of people have been asking, why have you left Australia and come to Canada? And look, for me, it's really simple. The Department of Family and Community Medicine here at the University of Toronto is one of the leading academic centres in the world in family medicine. I don't know if everybody who works here actually realises what a great international profile this department has, but there are some really remarkable people on the faculty. There's been a remarkable history of great people being part of this department. And when I looked from the outside and saw the amazing things happening in family medicine research, the extraordinary education programs, both for our medical students, for our residents, but also continuing education, the extraordinary global health programs which run through this department, and the impact that people in this department are having on the development of family medicine in countries in Africa, in the Caribbean, in South America and elsewhere in the world. This is an extraordinary place, and it's a real privilege to come and join as a member of the team. Well, arriving here as the new chair, the first thing I want to do is to find out about what's actually happening right across this department. There are over 1,500 faculty members in this department, a huge number of residents who are working with us, a great administrative team as well. It's a very distributed department, of course, working inside a large number of academic sites across Toronto and also into rural areas in Ontario. I have a lot to learn. So over the next few weeks I'm going to be visiting all of our academic sites. I'm going to be trying to meet with as many members of our faculty as possible, and to learn about what we're doing and to work with the people in this department to look at what are the new opportunities for us in research and education and innovation and global health, to talk about where people would like to see the department going. We have an existing strategic plan which I think is incredibly sound and very exciting and sets us some targets for 2020, but I want to look beyond that as well. I also want to look at how do we take what I'm told is the largest academic department of family medicine in the world and turn it into ensuring we're the most productive and socially accountable department of family medicine and community medicine in the world. My big aim is that when people all around the world think of academic family medicine, they think of the University of Toronto. And I think we have the potential here, with the great work which is being carried out by so many people, to have a real global impact in the work that we do. Family medicine is undergoing a major refocusing in many parts of the world as the world struggles with the dual challenge of how do you ensure universal health coverage, ensure that every single person in the world and every community and every country gets access to health care, and at the same time how do you strengthen primary health care in each country to make sure that you have a health system which can actually deliver that universal care. And family medicine provides one of the great solutions to these great global health problems. And at the same time, family medicine provides opportunities to address many of the very significant healthcare challenges that countries like Canada and many others are facing. The challenge of an ageing community, the challenge of rising numbers of people with complex chronic diseases, the challenge of addressing mental health challenges, the challenge of ensuring that the most vulnerable people in our communities are getting access to good high quality healthcare as well as the people who are more well off. These are global challenges which I think we're really poised to assist in addressing through the great work which is being done here at the University of Toronto.